It's a common practice in India when a child is born with ambiguous genitalia, when the parents or the relatives can't be sure whether this baby is a male or female. They are handed over to the eunuchs before any proper specialist intervention, going to a doctor, going to a hospital where there are specialist gynecologists who can diagnose the condition properly. They are just handed over to these eunuchs, and then this child will grow into adult and will spend a life of poverty, struggle, and exploitation. In Kolkata, where I live, there are several street corners where these people come and beg. It's such a pathetic condition. You go to developed countries, you won't find these beggars of this ambiguous gender. Now, to come to know about it, why this happens, we have to come to the basics. Now we know that each and every human being have 22 pairs of autosomes and one pair of sex chromosomes. This pair of sex chromosomes determines which gender or which sex the person is. For example, if somebody has a double X, XX, then she's a female, and somebody has XY, is a male. This lot of people know. Now, this a Y chromosome is the magic chromosome. It's a smaller, tinier than the X chromosome. Now, it can be only donated from the father of the couple, because the father only has the Y chromosome because he's a male person. And when this Y chromosome comes into the fertilization, it dictates the formation of the male genitalia, the male endocrine organ testis. If there is an absence of Y, there are conditions where there is X0, XO, Turner syndrome. In this condition, if there is no Y, then that baby will automatically grow into a girl. Now, only if there is Y, there would be superimposed masculinization. Now, this is the most basic thing, but this is not the end of the story. Apart from this chromosomes, there are certain hormones which causes this masculinization, of which testosterone is the most important. These hormones together are known as androgens. Now the androgens are secreted by the testis, and which leads to this uh, masculinization. Not only that, there should be efficient enough amount of androgens. There should be other thing. These androgens acts on certain receptors in the body. There must be these receptors, these active receptors, which can bind with testosterone and leading to the masculinization. So if there is a lack of androgens, even with the testis, if there is a lack of androgens, or these receptors are inefficient, then there would be this lack of masculinization. So there can be a person with testis without any male characters, physical male characters. These conditions are known as male pseudo hermaphroditism. Okay. In male pseudo hermaphroditism, despite the person having XY chromosomes and a testis, he may not have any masculine characters. Rather, he may become an very attractive female with a very smooth skin, well developed breasts, and a short and blind vagina. When I was walking in a particular hospital, a couple came, they are recently married, and when the couple told me, especially the lady told me about her problems, I immediately understood that she was probably a male hermaphrodite. Because they were recently married, the lady was very eager about a successful conjugal life, and they have come to me. So I have asked for a chromosomal analysis and hormone testing, but she never came back. Probably she understood that it would be known that she actually is a male and her marriage will break down, so she never turned up. Now, this condition, the male pseudohermaphroditism is when there is a receptor problem. It's known as now completely insensitive receptors, or this is known as now called XY female. Previously, it was known as testicular feminization, but that uh, phrase itself, but that nomenclature itself is quite insulting. So now it's known as XY female. And it is rumored that Queen Elizabeth the First was an XY female. Uh, there was a very famous lady in England who knew she was XY female, or he was an XY female. So she didn't change her identity, and she had a separate identity, and she quite confidently stayed in the society with her third gender identity. And this third gender now is accepted in many developed countries. So until now, I have talked about the male pseudohermaphroditism. There is another condition which is known as the female pseudohermaphroditism. In this condition, that person, that individual has ovaries but have no female characters. Now, this is because of outpouring of excess androgenic hormones from another endocrine gland, adrenal medulla, because of an enzymatic defect, and because of this enzymatic defect in the intrauterine life while the baby is inside the mother's womb, excess of male hormones or androgens are secreted, and by the time the baby is born, the genitalia becomes ambiguous. Now, these, when they are born, as I said before, the parents and relatives become really nervous, anxious, and they give the baby to the eunuchs without giving any treatment or going for the final diagnosis. Now, these female pseudohermaphroditism, which is due to this enzymatic defect, can be easily corrected from childhood. Now, with some medicines, they have to take the medicines throughout their life, but that's not a big problem. And if they take these medicines, this masculinizing effect stops there and there, and this baby girl later on can have a successful married conjugal life, even have a successful reproductive lifestyle. Now, what it is said is that this male and female pseudo-hermaphroditism are pretty rare, but true hermaphrodites with both ovaries and a testis usually are extreme rarity. These are not found. Female pseudo-hermaphroditism, I stress again, which are due to these hormonal excess due to the enzymatic defect, can be treated and can have a normal female reproductive life. Now we come to the treatment aspect of pseudohermaphroditism. Now, the main focus or the main target of this treatment is that to get that individual have a well-adjusted and happy social and a conjugal life. The reproductive ability or the reproductive capacity comes later. Human sexuality is a very complex thing. It is based on neuroendocrine factors, which means here the brain or the mind is highly involved, and along with it, the endocrine factors, which are the hormones. Now, there is always the overlapping between male and female characters and behaviors. You would see certain female having male characters, male behavioral patterns, and vice versa. So there is a not, society tries to make an yardstick for that, but there is no arbitrary yardstick to say that this is an ideal male and this is an ideal female. There would be always some overlapping. There was a young boy a long time back in studying in one of the famous schools in Kolkata who always told his parents that I feel like a girl. Don't make me a boy. Don't try to keep me as a boy. He wanted to dress like a girl, behave like a girl, and parents were not at all happy, could not adjust with that. and he was rebuked and scolded, and finally he committed a suicide. Probably he was suffering from, or he was actually a female pseudo hermaphrodite. Also, there is this condition of transvestism, which is present in each and every society. A girl dressing like a boy or a boy dressing like a girl. Now, these transvestites are well accepted in the Western and liberal societies. And there are certain celebrities you can remember, like Boy George. And in Far East also, they are taken into shows and they are sometimes become really big celebrities. But in India, this transvestism is looked down upon. I remember a long time back, I was returning after seeing a movie through Ravindra Sarovar. This area was desolate, remote in the night. I was walking down the lake and I could hear certain male voices speaking in a female tone. And I immediately understood that these guys, they can't do that in open society because they would be ridiculed. So they have chosen this remote place for their meeting and their own outpouring of emotions. They are human beings, and we should not be at all judgmental on this. So, talking about transvestism, we come to the very controversial topic of homosexuality, which is again present uh, throughout different societies across the globe. And it's been even said that it was present in prehistoric age by studying some corpses, preserved corpses. The scientists have said that. Now, there is an acceptance of this gay people in most of the liberal and Western countries. There was a gay cabinet minister in UK, and in USA, a bishop was appointed, even knowing that he was gay amid quite a lot of debates and uproar. But so this acceptance is there. India, as a traditional society, has always been very rigid and harsh against hermaphrodites, pseudo hermaphrodites, transvestism, and homosexuality. But recently, in one of the states, an MLA from the pseudo hermaphrodite community was elected. So our attitude changings and the new laws are being passed. That's great for these individuals. Not only that, these helps them to get accepted and in the society properly, and they are also prone to many diseases like HIV, more risk prone to HIV. So uh, that would help if there is an acceptance in law of these conditions of homosexuality, etc. Then these very deadly diseases can be curbed by medical intervention in a proper time. Now, these conditions have huge medico-social and other implication, diverse implications. They are human beings, and unless we accept them as are a human being like us, it would be a very cruel and harsh judgment. Norman Jeffcoat, one of the famous gynecologists of yesteryears in UK, had a treasure house of experience on this. He remembers a lady who was actually a man, was successfully transformed into a man, but later committed suicide because the society didn't accept him as a man. Now, that's what I'm saying. On the other hand, there was this particular case of Havela Jolie in UK, who was born as an XY female, and in his or her birth certificate it was written he's a XY male. And later on, at the tender age of 10, she found out her exact chromosomal status, and if she fought it like anything, and she wanted to remain as a XY female, not a male. And finally, because of this highly publicized case, she was accepted as she is. And this case can act as a template of about how we should approach and accept these people, these wonderful people.